Time for a little postpartum Q&A. So we have a couple questions this week that I want to answer for all of you. Our first question is pain while pumping. What do I do? All right, you guys, I'm not a lactation consultant, but I was an exclusive pumper for 13 months, so I know a little bit about this. If you're experiencing pain while pumping, there are a few things you want to look at. My first thing that I encourage you to do is check your flange size. So the flange is the part on the outside of the pump that actually suctions onto your breast. And pumps come with a standard flange, but this might not be the right size for your breasts and your nipples. And so you want to check the flange size. You can look online for a flange check, and you may need to get a different size, because if it is too big, it's pulling too much, it's not working appropriately. If it's too small, it's going to be tight and cause some pain. If that is not the solution, I want you to look into thrush, make sure that you're not dealing with that, and also look into mastitis. Just make sure you're not dealing with clogged ducts and engorgement. And if you continue to have pain while pumping, try to identify where the pain is. Is it deeper in your breast? Is it at your nipple? And this is something you might want to talk specifically to a lactation consultant about if the flange doesn't do the difference, and if there's not, an underlying issue like thrush and mastitis. One last thing you might want to look at is what kind of suction you're using on your pump. So if you are also nursing, you want this suction to mimic baby. I know how tempting it can be to up the suction to try to decrease pumping times, and I've been guilty of that too. But if you are maybe having too high of a suction and too high of a speed, that could just be too uncomfortable for your breasts too. Question number 2 is tips on making sex less painful, especially when you're a nursing mama. I love that she brings up being a nursing mama, because what this means is that often the hormones that are helping you to produce the breast milk are also decreasing your libido and decreasing the moisture that your vagina is able to make when you are getting in the mood or starting into sex. And so my number 1 tip, y'all, is more lube. Lube, lube, lube. I'm gonna put below the link for my favorite lube, Cocolube, and you want to be super liberal with your lube, and don't feel any shame or weirdness about that, because your body is just not in a place to make as much as it did before. My second thing, if you're experiencing painful sex, is to go to a pelvic floor therapist. This might be a physical therapist or an occupational therapist. Often you can get a referral from your OB or midwife, or just directly contact the therapist on your own. So some of these are insurance-based, some of them are private pay, some of them are coming to your home, some of them are going to the office. But there's so much that happens in that whole region in birth, pregnancy, birth, and postpartum. And in many parts of the world, pelvic floor therapy is standard care. So it's not weird at all if you need to go and have someone help you to rebuild that structure and that muscle and tissue after giving birth. If you want more information on this and just postpartum sex in general, I actually do interview a variety of people, from a therapist to a pelvic floor therapist, to historians and doulas and more, in my Back in the Sack postpartum sex e-course, which I'll also link below. Third question is about a C-section scar. At Postpartum Together, we call C-sections belly births, because y'all still gave birth, it just came out of your belly. So this mama is saying that at 3 weeks, she's still having a small amount of bleeding. Now, I did check in with this mama a little bit more, and it seems like it was fairly normal bleeding. When you look into this repair, this recovery, it's about 4 to 6 weeks when you want that bleeding to just substantially decrease or go away. This is usually the time when you have that postpartum checkup as well, to check your C-section scar. But I say this also saying, if you're feeling like something is out of place, if you're feeling worried, it's totally fine to check in with your provider. Send them a picture. Ask them if these things are normal. Never feel like you're being a burden, or that you shouldn't be able to check in with your provider as you are healing. Next question, can postpartum depression go on and off throughout the first year? Yes, yes, and yes. You are postpartum, which is not just depression. Postpartum is the season after baby. You are postpartum for a year-ish after baby. This means that your hormones, your neurological system, like all these things can take a year to even up to 18 months to recover. And so we see that postpartum depression can onset up to a year postpartum because of the changes of hormones. Now, we see that you may have weaning hormones, hormones related to nursing and ovulation returning, and there are a number of different things. But it is important to know that you might see some highs, you may see some lows, you may feel like you are having this off and on of postpartum depression through that first year. I say that to also say continue to stay in check with your provider. If you are using medication, continue your usage of medication. Don't just like go cold turkey on that when you're feeling good for a few days. If you're seeing a therapist, continue to bring that to your therapist and know that you are having ongoing changes. And so it's also normal that your emotional reaction to that will be ongoing as well. Postpartum depression is common. It is something that we don't need to be ashamed of. We don't need to leave it as taboo. And so if you are facing this, continue to talk to your provider, but know that you're probably going to have some highs and some lows throughout that first year-ish. And our last question this week is how to make baby responsibilities feel shared between a stay-at-home mom and a 40-hour work week partner. This is a really tough one that goes into so many different layers of communication and scheduling and understanding what it actually takes to take care of a baby. So I encourage my clients who are also stay-at-home moms to think about that as this is your 40-hour-a-week job. Your partner has their outside of the home 40-hour-a-week job. And now, how do we look at the in-between, the other things that need to be done? This doesn't mean that stay-at-home mom is also the default parent all night, all weekend, all the time. We don't want to fall into that default mode. What I use with some of my clients, and I actually do one-on-ones just for this, is block scheduling. This means that we aren't just kind of wondering who's on or hoping that the partner takes over. This means that we are being intentional and proactive about our time, about who's in charge, who's kind of the default parent, and when. This means that we can enjoy our time. We can schedule in time to be together. We can really schedule in meaningful family time. But this means that we don't have this default where the stay-at-home mom is also the person who's picking up the slack at 9 p.m. or the middle of the night or the weekends. And so be really intentional about your communication. Be really intentional about how we split that time outside of the 40-hour work week. And also honor the fact that being a stay-at-home mom is really freaking hard. And we can count that as our work. But that doesn't mean that our work is 80 or 120 or, however many hours there are in a week. This means that we honor that time, we honor our partner's other work time, and then we think about that in between and all the gaps that need to be filled and how we proactively fill that together. Thank you guys for submitting your questions this week on Postpartum Together over on Instagram. You can always head over there to submit questions for the week. Go to postpartumtogether.com where you can get lots of info on all of these topics. And I can't wait to see you again. Make sure that you subscribe so that you get the updates every time we get a Q&A or another fun postpartum new mom life related video.